It's no secret that the cost of healthcare can be astronomical. In the midst of the presidential election, the issue took center stage, and amid the COVID-19 pandemic, for the uninsured, the issue is that much more pronounced. According to the Census Department, that's more than 26 million people. Now, fast forward to today. The COVID-19 vaccine is being distributed. More and more jurisdictions are opening up vaccines to those with comorbidities, but they need proof from a doctor they may not be able to afford. The healthcare startup Sesame may have a fix. Their CEO joins us to tell us why. David Goldhill, CEO of Sesame, joins me now. David, thanks so much for joining.
Thanks for having me, Andy.
So give me the lowdown. Tell me about Sesame.
Well, Sesame is a marketplace for healthcare services paid for directly by the patient. So it's designed for uninsured patients and other, value-conscious patients, the number of whom seem to grow every day. People concerned about the price of healthcare, and either who don't have insurance or have high deductible plans, and find a lot of the care they're now required to pay for directly unaffordable.
So you're working on something kind of interesting. We've seen, especially with people with comorbidities right now, that they often need proof to get vaccines. You're working and doing some stuff to help them get that documentation if they don't have access to a doctor. Can you tell me what that is?
Well, it's basically a video appointment. A lot of the appointments during the pandemic on Sesame have been video with a doctor who can provide documentation attesting to comorbidity, depending on the state and the state's requirements.
What about this proof stuff? What is that looking like?
It really depends on the location. Many states have requirements in addition to age that if you don't meet that, if you're not 65 plus in a lot of states now, 60 plus in some, that you have either a comorbidity or that you are an essential worker. And depending on the location, states are requiring for the comorbidity a doctor's verification that you have a condition that would qualify you to get a vaccine at this stage. I will tell you those rules are changing very, very rapidly in a lot of the country and are being enforced, frankly, sporadically.
That's true. I can tell you from personal experience, I got the vaccine. I got the first dose about a month ago, the second dose on Sunday. And what kind of struck me is that I wasn't asked about anything related to any, health problems or comorbidities, which I had documentation of. How unique is that?
I don't know. I shared your experience when I went to the Javits Center for my vaccine. I had a comorbidity and I had a doctor's verification of it. I was asked what the comorbidity was, but I wasn't asked for proof of the comorbidity. I hear anecdotes that's true in a lot of places. And look, the public health imperative is to get vaccines in as many people as we can, as quickly as we can. So you have someone standing in front of you ready to get a vaccine, probably the smartest thing to do is to give that person a vaccine. And I think that's what you're seeing in practice, even where the rules might say something different.
I want to get back to that verification. Where is that available?
Well, we started it in New York, but anybody can go to a Sesame doctor and ask for verification of a condition. It really is a matter of state by state regulations. And as you know, those are changing very, very rapidly.
So it's not specific to one location.
We did start in New York because we have a large number of doctors in New York, and the rules in New York look pretty specific around comorbidities that made you eligible originally before age 65, now before age 60. And so it was a service that a number of our doctors thought would make sense to provide for patients who really did not have regular care.
A lot of other places aren't as far along as New York. So this is, just to be clear, this would be available to them?
Yeah, Sesame is a marketplace. And so what happens is doctors list the services they're willing to provide. And I think many are happy to provide this throughout the country where needed.
David Goldhill, CEO of Sesame, thanks so much for coming on.
Andy, thanks for having me.
That's your Business Brief. I'm Hirschfeld in New York.